Good morning, everyone. Thanks for coming here today. My name is Don Davies. I'm the Member of Parliament for Vancouver Kingsway and the New Democrat critic for health. Before I jump into the subject matter of the news conference today, I do want to address an issue of, I think, great concern to many Canadians right now, and that is the shortage of pediatric pain medication. I don't think there are any issues more important to Canadians than the health of their children. And when their ability to respond to their children's pain and their illness is compromised, I think that's a crisis of the highest order. Now, many of you will remember that drug shortages in this country are not new. A few summers ago, we faced an EpiPen shortage that threatened to put people with allergies into anaphylactic shock, and we faced a crisis at that time. And of course, our country was unable to produce a COVID-19 vaccine because we lacked the domestic capacity to produce essential medicines and vaccines in this country. For many years, the New Democrats have been calling on the federal government to establish a public drug manufacturing capacity, preferably through a crown corporation, for exactly the kind of situation we're facing today. Canada, as a G7 country, should never be in a position where Canadians are left vulnerable to shortages of life-saving essential medications. And so once again, we are calling on the federal government to establish a public drug manufacturer in this country to produce essential medications and vaccines, and also to exercise its power called compulsory licensing, which exists when a patent holder is unable or unwilling to produce medication that they hold under patent. The federal government has the power to produce that medication itself. And that is a step that the current Liberal government has failed to take up to now. I understand they're working with private drug makers to try to facilitate more medication for Canadians, but that's clearly not enough and it's not working. I might point out that the shortage of pediatric child medication, and that's not only pain medication, but also antibiotics and other essential medication, is a global one. And so there isn't an answer that exists outside of the Canadian borders. We have to solve this problem ourselves, and we do it domestically by having a public drug manufacturer in this country. I'd now like to address the subject matter of the news conference today. When the COVID-19 pandemic struck Canada, all levels of government had to respond in order to keep Canadians safe. Now, as we approach the third anniversary of the beginning of the COVID-19 pandemic, people deserve to know why certain decisions were taken, what mistakes were made, and if their government acted appropriately. Throughout the pandemic, New Democrats and many experts and stakeholders identified the eventual need for a fully independent, comprehensive, and penetrating review of Canada's COVID-19 preparedness and response. With the emergency pandemic conditions behind us, now is the time to act to ensure transparency and accountability from government and to make sure that lessons are learned for any future pandemic or other emergency. That's why today I'm calling on the federal government to launch an independent public inquiry into Canada's COVID-19 preparedness and response under the Federal Inquiries Act. Now, to date, Prime Minister Trudeau has deferred questions about a COVID-19 inquiry, saying that there will be time for a, quote, lessons learned exercise, end quote, someday in the future. For his part, Health Minister Jean-Yves Duclos has noted that a government decision could come soon on what kind of review should be held. However, when asked if such a review would be independent, he would only say that a, quote, strong review, unquote, is necessary. To us, it's unacceptable that the Liberals will not commit to an independent review of Canada's response to the most severe pandemic in a century. We can't put politics above public health. Instead of papering over the federal government's inadequacies and mistakes, We must leave no stone unturned to learn from the past errors and to prepare for future threats. Many prominent health and security experts have called for the federal government to launch an expert-led independent inquiry into Canada's COVID-19 response. Now, under the Inquiries Act, commissions of inquiry are established by the federal cabinet specifically to impartially investigate issues of national importance and to provide findings and recommendations. Commissions of inquiry have the power to summons and subpoena witnesses, to take evidence under oath, to order production of documents, and to retain the services of technical advisors and experts. Hearings, importantly, are also held in public. Now, the Liberals want to provide the illusion of oversight and accountability with inadequate internal reviews. For their part, the Conservatives want to play political games with a partisan pandemic panel called for by Preston Manning. For our part, New Democrats want a full, fair, and public COVID-19 inquiry, properly resourced and accountable to Canadians, acting fully in public and led by independent experts. Canadians deserve no less. Thank you, and I'm happy to take any questions you may have.
Are there any questions in the room? Kevin?
Good morning. Just to touch on what you're talking about right now with this review you're calling for through the Inquiries Act, you're saying would be completely independent, non-partisan. I think that the arguments that Preston Manning's also making is he's saying he wants this sort of citizen review. Can you tell me why you think that the Inquiries Act route will be interpreted, in your view, as a more independent approach, rather than specifically what Mr. Manning's saying is that, well, his problem is that he's worried about politics getting in the review itself. And we know that the debate over public health restrictions has become very political in this country, especially later on in the pandemic. So why do you think that's the way to keep this review independent and politics out of it?
Well, thank you. That's an excellent question, and I think the very reason for an inquiry under the Inquiries Act is made all the more necessary because of the very politicized nature of the pandemic to date. And I can't think of a more political figure than Preston Manning and calling for a citizens' inquiry. The bottom line is Mr. Manning's proposal is partisan, it's compromised, and it's unnecessary. One of the reasons that he's calling for a citizens' inquiry specifically is because he says there is no federal or provincial inquiry being called. So, of course, if we call for an official inquiry under the Inquiries Act, that makes his proposal unnecessary. We've looked into the inquiry that he's calling for, the citizens' inquiry, so-called website, and already it is being identified by stakeholders and experts as being something that looks like it's partisan. The website provides 2 samples of potential witnesses, both of them people who have claimed to be badly injured by vaccines. A photo posted on the Citizens Inquiry's website depicts a march protesting against the COVID-19 public health measures. I know that noted Calgary public health officials are saying that they would not participate in such an inquiry because they believe that it has a preordained conclusion to it. So those are reasons why we think that that inquiry is too partisan and is designed to be that way. Canadians need to have confidence that any inquiry that it does a root to branch examination of the federal government's response is credible and completely untainted from politics and politicians. You may remember that after the SARS epidemic, there was an inquiry called, chaired by Dr. David Naylor, and that led to the creation of the Public Health Agency of Canada, by the way. We think that we almost need a second stage of that, and a public inquiry can now look at how the Public Health Agency of Canada actually performed its role as envisioned by the previous one. So to make it short, only a public inquiry under federal legislation that is designed to be objective and independent with all of the internal guarantees of that, I think will satisfy Canadians that they're getting an objective examination of the issues.
And I Just the shortage of medication for children. I do want to ask you about that. So you're asking for the federal government to produce these products. I know that there's also been criticism about the packaging, that if producers get a hold of these drugs that are the same drug just with a Spanish lettering on it, or what have you, they would increase the supply into Canada. Is that something that you would push for, to sort of have a temporary pause as well on the requirement to have bilingual English and French packaging? Or because I don't see how the federal government, we already saw that there wasn't a huge influx in, I mean, it's taken a long time to get up this vaccine program, for example. So I don't see how the federal government can turn around on a dime and produce the necessary medications that we have a shortage of right now, that you could also source in foreign markets that don't have the same sort of packaging laws that Canada has.
Yeah, you've kind of put your finger on the real challenges facing this. So first of all, the Health Canada does have the power to bring in foreign labeled medication into Canada. They have that power under regulations now. However, that does not obviate the necessity of translating into both official languages and also making sure that the warnings are there. We passed a motion at Health Committee to do just that, to make sure that Canada does explore the ability to import foreign language labeled medication, but it has to be appropriately translated into both official languages. The problem is that this is a global shortage. There is no glut of children's pediatric medication around the world that Canada can get. That's why that measure is insufficient. I agree with you that there is no instant fix to this other than the power of compulsory licensing, which is exactly for this situation. Where you have a serious public health emergency and a patent holder is unable or unwilling, in this case, it's not being unwilling, I think it's unable, to produce medication in the amounts necessary, the federal government can act on that patent. And it would take extraordinary efforts, but they could get pharmacies that have compounding abilities to be producing that patented medication. So that is not being done right now, and I think that's about the only thing that will act to start getting more of this medication produced quickly in Canada. The public drug manufacturing capacity, I agree, is a more medium to long-term solution, but how many of these emergencies do we have to go to and go through before we recognize there's a structural problem in this country? I'm telling you, if Canadians knew how often the drug pipeline in this country was perilously close to shortage, I think they would be shocked. And this goes for oncology drugs, particularly pediatric oncology drugs. It goes for pediatric medication, drugs of all types. And my final point is, Canada at one point did have a federal, nationally owned drug manufacturing facility. That was Connaught Labs. And it was the Brian Mulroney government that sold it. And the Liberal government, I believe, said that they would look at that and bring it back. They never have. So this is a perfect opportunity for us to take a short-term measure, but also understand the structural problem and make sure this doesn't happen again. The only way to do that is if we have the domestic ability in this country to produce medications, that particularly ones that are essential for human health.
Next question.
Hi, two questions. First one is, I'm wondering, you bring up the fact that with an inquiry, there's the subpoena power. So I'm wondering, are there specific individuals you'd like to see subpoenaed?
Well, I haven't gotten that far, or I don't want to prescribe the witness list at this point here, but I think that Canadians would expect that every senior person who was in a position of authority and decision making should be answerable to them. And so I think what's important is that the inquiry is fully resourced and comprehensive and public, so that we leave no stone unturned. So we should hear from everybody that had anything to do with any of the major decisions about how we handled the pandemic. And they should be able to Canadians should be able to see that testimony in public, and those people should be thoroughly questioned.
So Prime Minister Trudeau, Minister of Health, would you like to see them testify?
There's no Canadian that is, I think, exempt from being answerable to the Canadian public. If they have evidence and information that the inquiry commissioner and their council think is important, then they would not be exempt, as no one else should be.
Okay, and my follow-up question is, I'm sure you're very aware that COVID-19 has also come with a lot of conspiracy theories out there about the pandemic. I'm wondering, how do you think a public inquiry should be navigated while being mindful of those kinds of conspiracy theories about the government, about the pandemic?
Well, first of all, that's why I think it's so critically important we get the structure right. Because this pandemic has been so politicized and there's been a lot of misinformation and disinformation and legitimate questioning of official policies, that it is vitally important that we have a structure that is credible and empowered. And that's why those powers of calling witnesses, being able to get production of documents, taking evidence under oath, having a properly resourced commission with counsel and technical experts, being conducted in public, filing a report. These are all internal guarantees of credibility that I think Canadians deserve and want, so that any outcomes that come of this are reliable. That's why I think citizens' inquiries that are led by right-wing politicians that are playing to a certain political crowd would be destructive and won't meet our goals. The Liberal bill that has been C-293 that was tabled in Parliament from one of my Liberal colleagues, Nathaniel Erskine-Smith, would have the Minister of Health appoint an advisory committee. So just stop there. The very person who is responsible ultimately for the pandemic response, Minister of Health, would be appointing the people that would review him. Clearly there's a conflict of interest. It's an advisory committee that has no powers to summon witnesses, no powers to order production of documents, doesn't even require that a report be tabled in Parliament. So that's why I'm seeing disturbing attempts from both Liberals and Conservatives to try to steer this inquiry into a political direction. That should not happen. And that's why the NDP is saying only a public independent inquiry will suffice. Again, it was done after SARS, and we got really good recommendations from that. It's what established the Public Health Agency of Canada. But again, I've been health critic throughout this pandemic, and I can tell you that there are significant questions about the way PHAC has handled this pandemic. And so this is an opportunity for us not only to hold them accountable, but to learn the lessons so that we can make recommendations to improve in the future. And only an objective, non-political process will accomplish that.
And this concludes the press conference. Ceci met à la conférence de presse. Merci.
Thank you so much for being here.